Hi, everybody. This is Beth, Liston, physician, state representative, and still working to teach everyone legislative advocacy for public health students and those who are engaged and knowledgeable about health impacts of policy. Today's discussion will be about the Ohio Legislature. Obviously, if we want to participate in legislative advocacy, it's important to understand the structure of the institution that we're talking about. Ohio has a specific structure. Every state structure is different. We have an upper house and a lower house, a Senate and a House of Representatives, just like Congress does, so just like the federal structure is, but that is not true across the country. So if you're not in Ohio for legislative advocacy, make sure that you really do look up what the structure is, because it can be very variable. Every 2-year block is called a General Assembly. As we heard before, as you know, there are elections for representatives every 2 years. And so the membership of the body changes every 2 years, and everything is done in that time frame. We're currently in the 133rd General Assembly, but obviously, you can look up legislation from previous General Assemblies, and you'll see that term GA if you start looking into politics and state house news and such. The state budget is set every General Assembly. So this is where a ton of policy happens. A lot of the spending, how much money is allocated for different programs, and even some law priorities are put into this budget bill. It's a must-pass bill that everyone works on for that very first 6 months of any General Assembly. Bills introduced during one General Assembly don't carry over to another. So if the bill gets introduced and doesn't pass and doesn't become law in that 2-year time frame, it's essentially erased at the next start. So every 2 years, you have to start all over again. Serving in the Ohio General Assembly is part-time. Most are part-time across the country. Ohio is actually one of the more full-time part-time roles, as in we meet a lot, we're in session a lot more. It's a bigger job. At some places they may only meet for 3 months and then you never see them again for the rest of the whole term. So there's a lot of variability. Most legislators, though, do have other activities, whether they're businesses they run, other jobs. Some are retired. There aren't that many that are doing this as their full-time career, although there are some. There's a fair bit of variability. And people travel for this. Some people actually, have to drive 3 hours just to come in for a meeting or for a session or for committees, and that affects the schedule a fair bit. So the session calendar is variable. The speaker sets the dates. The Speaker of the House, the Senate President, the leaders of the two chambers set when the meetings are and when the bodies are what's called in session, which means that committees meet and the whole legislative body will meet and vote on things. At the beginning of the General Assembly, right after the election year, everyone's sworn in. I was sworn in at the beginning of January in 2019. It was a pretty awesome experience. I got to go in and, it was be part of history. And the State House from the inside is really an amazing building that if you take a tour of, they'll give you a lot of the background and information, where Abraham Lincoln was and the history of our state. So I encourage you guys to do that and take the official tour. But then the legislature is in session, essentially the first 6 months, working on that budget, trying to make sure the spending priorities align. The budget is drafted by the governor, it's sent to the House then decides what they're going to keep, what they're going to change. They send it over to the Senate, and then everyone has to come back together and agree. And that's a more intense time. Now, technically, legislators are only in session or in Columbus from Tuesdays through Thursdays, and that relates to that travel, right? It takes 3 hours to get in for some people, and so they may come in on Tuesday morning and spend the night on Tuesday and Wednesday, and then leave and be with their family on Thursday. Rarely there are meetings on Mondays and Fridays, but that's more things like the Finance Committee when we're setting the budget, because that's who does all the hearings for the budget. Then there's a summer break. That's typically July through September. And then we return into session September through December. other than there's a holiday break, so it may only be early December through year 2 of the General Assembly. January through June, the legislature will meet in that second year. This year is a little different because of coronavirus, but typically this is a more intense legislative time. And then July of that second year, the state legislature goes on break essentially until November. It's a summer break, and then there's elections that happen again. It's a pretty quick cycle. We all return after the election in November and then December, and that time period is called lame duck. So some people who are term limited, this is their last time to get their bills through. This is the furthest away from any election that people will be. So if there's bills that people don't think are popular, this is the time where they might be passed. Every bill that hasn't had a hearing yet will get a hearing if it's required. Remember, it's in that first 18 months of General Assembly. If a bill is submitted, then it has to have a hearing. There's a lot of bills that hadn't yet have hearings that are going to get a quick hearing in this lame duck time. So it's a pretty intense time frame. In the Ohio House, here's the current makeup. Obviously, this will vary election to election. There are 99 members, and of them currently in the 133rd General Assembly, 62 of them are Republicans, 37 are Democrats, and I've already referenced the Speaker of the House. That's the majority leader in the House, and the minority leader is somebody called the minority leader. These are standing committees, and there's a lot of them. Primarily, you'd be thinking about health as being where health bills are, although sometimes there's politics that get involved, and so bills can be assigned to different committees. If it deals with health insurance, sometimes it'll go to insurance. If it deals with penalties, it might go to civil justice, even though the people on that committee are a little bit more often lawyers than people with a health focus. There's a lot to that process. In the Ohio Senate, we have 24 Republicans and 9 Democrats. The majority leader is called the Senate President. The minority leader is also just called the minority leader, Senate minority leader, which is House minority leader. There are committees there too, slightly fewer because there are less senators, but every member in the House has about 3 to 5 committees assigned, and the senators have more because there's only a third of them. Each office has some staff. It's not a huge operation. In the House, everyone has one legislative aide who runs the office, and that's someone that you might meet with instead of the actual legislator, and they're there full-time, unlike the part-time nature of the elected office. They're there 9 to 5, Monday through Friday on normal circumstances. The Senate, they'll have 2 aides. The majority gets a little bit more assistance. So there are aides that sort of float between offices. There are some that might be assigned to the big committees. So, for example, the chair of finance and even the ranking member, which is the minority leader in finance, will have some extra staff sometimes to be helpful because there's so much that goes into that budget document. We have interns and pages that can help. There's a lot of college students that work as pages in the State House to get that experience. And then each caucus, and caucus just means group, either to group or a group, noun or verb, caucus. So the minority caucus or the majority caucus or the Democratic caucus or the Republican caucus, those groups, they each also get some staff to assist with policy and support the committees. Where there's a handful of individuals that do that, and a couple of additional staff to help with communications. And the number of staff is somewhat proportional to the size of the caucus. So in the 133rd GA, there are certainly more Republican staff than Democratic staff, and most of the leadership offices are run by Republican staff members. Committees, I already kind of gave you a list, and if you remember in how a bill becomes a law, bills are assigned to a committee by rules and reference. Each committee has a chair, the chairperson, that is appointed by the Speaker, and a vice chair also appointed by the Speaker in the House, or the Senate President in the Senate. And then each committee has a ranking member, and that's the minority party member who's functions as the head of the minority group within that committee. That is recommended by the minority leader to the president or speaker, although they're technically in charge of all of the appointments, and they're technically in charge of all the hiring, even for the minority staff members. It is always the Speaker of the House or the Senate President that is in charge of that. And then the committee chair determines the committee schedule. And it's usually posted the week before in terms of what bills are going to be on the schedule, but it has to be at least 24 hours, and sometimes things change a ton before the committee meets in terms of what bills are going to be heard and what may have a vote. Anything that has a vote also has to be indicated 24 hours advance, and you can see that on the committee schedule. So let's look at that a little bit. Let's spend a few minutes and look through committees and bills in committees. And I think it makes sense to just do it from our basic website. So if we just go to legislature.ohio.gov, right? We'll start here. And if you are really excited about a policy piece or interested in legislation that relates to public health, you can search. Now you can search in the committees and take a look at those, or you can search by the actual keyword, right? If you go into the search bar and you say, hey, I'm really interested in tobacco cessation programs or tobacco regulation, what's going on right now in the Ohio General Assembly with tobacco? You can search the key term tobacco. Make sure you're in the 133rd General Assembly, although you could change that if you wanted to look at what passed last year, or at this point a year and a half ago for the 132nd General Assembly. You can go back to that and do the same search. And then it'll give you all the matches on the keywords. Now we're going to take a closer look at this House Bill 11. So House Bill 11, and you can see it says the title is Regards Tobacco Cessation and Prenatal Initiatives. All right, sounds like relates to public health. Let's get more info. And if you click on that bill, you'll get to a screen that looks like this. So you'll get to the summary one first. And you'll see who the primary sponsors are. You'll see who the co-sponsors are. And there's a lot, because this is actually a bill that passed. And so that means at every vote, people have the opportunity to add themselves as sponsors. And it was a pretty popular bill. You go to documents, you can pull up the different texts, the analysis, that's the plain language version. The legislative text is what the code looks like. Right, you can go to status, it was effective. So this went into effect this year. You can look at votes, and you can look at committee activity. And this is really helpful too, because if you want to know what's going on in a bill, especially one that necessarily hasn't passed, you want to be able to see where it stands in committee. And so here, if we click on that, we can see the committee to which it was assigned is health, and that it had its first hearing May 21st, 2019. And you can go and look through and see all of the different hearings it's had, who spoke against it, who spoke for it. And if you wanted to, once you knew that that was assigned to Health Committee, you could go to committee and find health, right? You click on health, and we'll see all of the members, including the chair. So this is a person that you might reach out to for more information. Here's the ranking member for the minority party. You can look and see who all the legislators are. So if you wanted to advocate, you could certainly reach out to yours. You could reach out to anyone on the committee, because they're the ones that'll be asking the questions and hearing the people testify. And you can click down and see more. All right, the last time the Health Committee met was this date. These are the bills that they heard. Here's the analysis of the bill. You can look and see who spoke, and you can download actually what they submitted and what they said. You could do this for any committee in the House or in the Senate if you search for that legislation that relates to what you are looking for. Now, if you're looking for future meetings, you have to be able to know the committee schedule, right? When is the committee going to meet next? And as I said, that's a kind of a changing process, and you can go there and say, all right, there's no meeting scheduled for this week. And it's always going to be on here where you can look each week. We're not in session right now. And if you go back to that calendar, we're probably not going to be in session for a while in terms of having regular committee meetings and hearing bills. So knowing that is helpful too, especially as you time your advocacy. Okay. So let's go back to that one bill that I was looking at, which is House Bill 11, and which we know enrolled, but we're going to talk a little bit more about it. This really does have a lot of public health focus. So this is the summary from that plain language analysis of the bill as it passed. It basically said that state benefit plans had to cover some tobacco cessation services. It had a grant program for some group prenatal care services. It gave money to the grant program. It increased the dental program for pregnant Medicaid recipients so that they could get 2 dental cleanings. It provided educational materials on lead-based paint, and it increased some appropriations for a Families First Coronavirus Act. So a lot of different components of this. It's not as simple, did one thing, but a lot of it that relates to public health. In order for a bill like this to move and to get through both chambers, there obviously were a lot of supporters and people following. Now, if you want to follow a piece of legislation, it's not always simple. As I said, you can follow the committee schedule. You can email the committee's chair to get that schedule for that committee sent to you each week. So I would actually recommend that if you're really following legislative advocacy, email the health committee chair's office. You can click on the website, you'll click on it and it'll bring you an email and ask to be added to the schedule, and they'll do that for you. There are definitely news tracking services. There are also advocacy organizations for any particular issue that you're following, but it does move quickly, so you have to rely a little bit, I think, on those advocacy organizations or tracking services, or make sure you look each week on that committee schedule. But if you're tracking a bill and you know it has something to do with public health and you really feel like it's important, I think like many would say for House Bill 11, we need people who testify, and that's important in public health. Testify just means speak before a committee at the hearing to provide information on the bill. And it sounds a little scary, but it's not. Well, maybe it feels scary, but lots of people do it. And the more people that do it that have real knowledge, experience, and understanding of public health, the better the policy will be. So all hearings have recordings. So the Ohio channel, and actually that's .gov, I apologize. It's www.ohiochannel.gov. And I will change that so that I don't make that mistake again. I apologize. If you go there, you can watch what testimony people have given. If you're following a bill and you're nervous about testifying yourself, you can watch others give testimony and learn about what people are saying about a bill. So if you go just to the Ohio channel, this is what you'll get. Oh no, it's .org. I apologize. Okay, .org. Honestly, I just Google Ohio channel and it always comes up. So hopefully no one gets confused on that. So ohiochannel.org. And if you come here, you'll see all of the Senate sessions, all of the House sessions, even Supreme Court sessions. They're recorded and archived. And you can go down and find the committee that you're interested in. So we knew House Bill 11 went through the House Health Committee. So we just have to go down through and find the Committee for Health. And if we do that, and remember how alphabetical order works, then we'll be able to watch all of the proceedings. So Each time the committee meets, there's a recording of what was said and done, and you have the opportunity to learn about any bill that went through the House by watching this. But I also hope that people will engage and actually speak about some of the bills that they have knowledge and expertise on. And so I want to show some clips related to House Bill 11, because there's a lot of different people that spoke on this, and I think it helps to demystify a little bit what that might look like and make it a little bit easier for people to feel comfortable doing it. So in order to provide testimony, you just have to email the chair's office and say you would like to testify on a bill. They're going to ask that you submit something 24 hours beforehand, a written statement of sorts. This isn't a peer-reviewed article. This is, a 5-minute speech about why you care on this bill. And you're not going to be required to say exactly what you wrote. You just can write what you want documented, or sometimes people send in graphs and charts that they think are important to support what they're saying. But they'll ask you to send something in, and then you show up for when the hearing is called. The chair will call you up, and you have the opportunity to give your speech. It's that simple. So let's look at a couple of the pieces of testimony on House Bill 11. Some of this will get a little long, but also very interesting, and you'll see there's a lot of different perspectives that were brought in for this.
My next witness slip is for Dr. Gregory Henschel. Thanks for coming down, Doctor.
My pleasure. Thank you. Chairman Burke, Vice Chairman Hoffman, Ranking Member Antonio, members of the Senate Human Services and Medicaid Committee, thank you for the opportunity to testify to you today on behalf of the Metro Health System, which supports House Bill 11. I would also like to thank the sponsors of the bill, Representative Manning and House, for bringing such important legislation forward, which will address infant mortality rates in our state. I am Gregory Henschel. I am the chairperson of the Department of Dental Medicine at Metro Health System in Cleveland. We are a safety net medical system that cares for the most vulnerable and underserved members of our community. Our system cared for over 300,000 individuals in 2018, and my department cared for 33,000. As intimated in my written testimony, there are several concerns regarding the health of the unborn baby and expectant mother in the presence of periodontal disease. The significant health concerns include a 5 to 38% increased risk for preterm birth, a 6 to 41% risk of low birth weight, and a 10 to 55% increased rate for preeclampsia. Up to 20% of preeclampsia develops into eclampsia, which does pose life-threatening conditions. All of these may contribute to infant mortality and preterm delivery. HB 11 is an important next step in addressing these concerns. Periodontal disease in pregnant females is not uncommon, and the term pregnancy gingivitis has been coined to refer to this variant of disease found in expectant mothers. This disease is caused by underlying hard deposits on teeth and below the gum line. These deposits harbor bacteria which thrive in the conditions of pregnancy where the female hormones of estrogen and progesterone are upset. Likewise, in individuals who smoke, their systems are additionally challenged to their immune system, and we find a high prevalence of periodontal disease. Treatment for this disease can only be accomplished by a dentist or a dental hygienist. Currently, the Medicaid system only provides for one dental cleaning per year, which is wholly inadequate to address these concerns. As outlined, the current schedule may not even allow for a cleaning during the actual period of pregnancy. Understand that most insurers make an allowance for 2 dental cleanings per year, plus additional periodontal therapies. The additional visit will allow for reinforcement of smoking cessation by the dental team and reinforce proper oral hygiene. Addressing both of these issues during pregnancy not only addresses health concerns for the baby and mother during pregnancy, but can create new habits which continue to benefit the baby and mother long after childbirth. HB 11 will address underlying issues for the health of the baby and the mother, and has the potential to have healthier outcomes for both. I and the Metro Health System support HB 11. I appreciate your time to present this information. May I answer any questions?
Thank you. Any questions of the doctor?
Thank you.
Seeing none, thank you very much for your time.
Thank you.
Okay, so I know not exactly riveting television, but we had a health expert coming in. He established a little bit about why he was an expert, gave some numbers, and then really talked about the disease that he knew about, the current way it works, and then why this would be better. Now, he only focused on the one part of the bill that is part of his expertise, right? He's a dentist and he's coming in and talking about the dental component, the dental effects. So you don't have to talk about everything in the bill. You don't have to give the entire background on the bill or research a ton of stuff. Just talk about what you know and the component that matters to you. And that's information that not all lawmakers will know. There might be people not familiar with exactly how dentists are covered, and obviously not everyone's going to know what private insurance usually does and what that looks like for people. So I think that hopefully that gives you a sense. It doesn't have to be very long. A lot of times there are no questions. Sometimes there are, and then you have the opportunity to shine or just say, I don't know about that part of the bill. A couple of minutes can really make a big impact. All right, gonna continue forward because we have a different type of witness coming up.
My next witness slip is for Miss Marie McCausland. Welcome.
Hi. Chairman Burke, Vice Chair Huffman, Ranking Member Antonio, and members of the Senate Health, Human Services, and Medicaid Committee, thank you for the opportunity to discuss the importance of House Bill 11, which would support pregnant women in Ohio. I am grateful to Representatives Manning and House for sponsoring the bill and to the House for recognizing the essential nature of the work to combat infant and maternal mortality in the state and unanimously passing House Bill 11. This bill would provide dental coverage to pregnant women and group prenatal care to women on Medicaid, which I believe will help decrease infant mortality in the state and increase overall women's health. My name is Marie McCausland, PhD, and I'm a scientist, mother, and maternal health advocate living in Parma, Ohio. I previously came before this committee in support of Senate Bill 101, which would designate May as Preeclampsia Awareness Month, and described my harrowing near-miss story with postpartum preeclampsia. Very soon after my testimony, Senate Bill 101 was passed unanimously. I spent the last 2.5 years since my near-death experience helping change policies in Cleveland, Ohio, and across this nation so that no woman has to lose their life while giving the gift of life.
And I'll pause that there because I think you can see a little bit of the difference, but also another flavor of someone coming in. This is a person who clearly has some expertise and background, but then also had that personal story and motivator. She was speaking to something different in the bill, not as much about the dental health, but instead some of the prenatal care components, and then providing that personal experience to show, again, why it matters. So, there's a lot of different angles or avenues that you could come at this, and it all has a value in the discussion. All right, and there's one more that I'm gonna to bring up to show another piece of testimony.
My next witness slip is for Spencer Cahoon. Thank you for being here.
What's that? Well, thank you, and good afternoon, Chairman Burke, Vice Chair Huffman, Ranking Member Antonio, and members of the Health, Human Services, and Medicaid Committee. My name is Spencer Cahoon. I'm an attorney, a Bexley resident, and host and producer of the Emerging State Policy podcast. In this podcast, we look at the research, impacts, and political leaning of lesser-known state policies. For our second episode, we focused exclusively on group prenatal care and its most common implementation, the centering pregnancy model. I have reviewed numerous research studies about the outcomes of centering pregnancy compared to traditional individual prenatal care, and have discussed the matter with Dr. Valerie Good, a family medicine doctor using the centering pregnancy model, Angie Truesdale, CEO of the Centering Healthcare Institute, and New Jersey Senate Republican leader Thomas Keene, who sponsored a bill supporting the expanded use of centering pregnancy in that state. From that background, I am here today to testify in support of the group prenatal care component of HB 11. Now, given the multiple presenters who have already addressed the centering pregnancy model,
and just point out, I would call this an interested citizen more than even anything else, right? He's a lawyer, but he's been studying stuff and talking to people, and he's saying, hey, I'm studying stuff and talking to people, and I want to share. Clearly, that can be helpful to the conversation, but hopefully it helps you realize that if you're studying stuff and are talking to people, and you have some training and background, that you have a level of expertise that really has value to the process. So I say this just to hopefully encourage people not to be intimidated by sharing what they know, what they've studied, and what they're passionate about. That we have people that have a specific focus. We have people that have a personal story. We have people that just have an interest come and share what that is when we're discussing legislation. And the more people who have experience, knowledge, and training in health and public health that are part of the conversation, the better the outcomes will be. So I hope that moving forward, people will consider, providing testimony. Spend a little bit of time on the ohiochannel.org. Watch it, see what you think, and you'll learn a fair bit about the bills and the process just doing so. There's a lot of work to do for health in our state, and I'm excited for all of you to get engaged. Thanks.